Should we press continue?
Participants started to increase, and then we'll give just 2 minutes and we'll start, inshallah. I think we can start, Dr. Sriti. Yep, thank you, Dr. Sriti. Okay. Dear Dr. Sriti Nair, Dean of College of Arts and Science at Abu Dhabi University, our distinguished colleagues, it's a pleasure to have you with us. Good evening all, Assalamu alaikum, wherever you are. It's our pleasure to welcome you in our third professional development certificate, School Counselor Readiness for Change, part of EDU 2030 Future of Education series. To start our professional development certificate, allow me to invite the Dean of College of Arts and Science, Dr. Sriti Nair, to welcome you all and to share her thoughts about school counseling. Dr. Sriti, please.
Good evening, everybody. I'm very much excited and thrilled to have this session conducted by Abu Dhabi University, very close to my heart. I'm an education psychologist by profession, and I have served my initial life career was school counseling. So I have worked closely with students and faculty and school teachers while I was in India. And also when I came to UAE, my first footsteps were in school counseling. So I do understand how important and valuable is a school counselor to the education sector, especially to schools. I know that it's challenging. We are still struggling to find proper pathways and proper identification, and to make the social and cultural differences and government and institutions to understand how important a school counselor plays in the life of children. So we are talking about school counselors working with early childhood period all the way to high school teenagers and this is a spectrum of varying age level that you have to understand and deal with. Many of us have gone through the situation that we may be good in something and we are not good in something else, but we try our best to make sure that we upscale our competencies, our skills, and based on the needs and requirement, we always make sure that we are understanding the situation and act accordingly. This session is coming at the right time. 1.5 years in the pandemic situation, we know how much we have been through. As individuals, we have been through struggle and readjustment of our life cycle and lifestyles. Similarly, has education sector gone through a drastic 180-degree change in various ways. You would have encountered parents panicking that they cannot deal with the stress that they have to deal with students from their own kids from home, which technically the school was managing them for 8 to 9 hours. This is now being challenged at home. We had situations where students who were high performing in a school environment start suddenly completely dipping off and not able to make the needs required. Those students who need special support, when we talk about special support, we know schools are many times having issues with students having learning disabilities, and we do one-to-one attention and we take care of things. This was again challenging. Career is another thing. Students got into this dilemma of what am I doing with my future? Which university is going to accept me? So many career counselors found it very difficult to understand with the changes that is happening with final exams, with all the reports that students generally was easy flowing. How are we going to manage? So in this particular time, a counselor challenges himself or herself by saying, am I ready for these changes? So Abu Dhabi University's education department, when we thought about conducting series of sessions and professional certification programs for teachers, for education leadership people, we said we cannot leave out the special educators and also the school counselors. So the third session we are doing is for the school counselors, where we are trying to discuss. So please do understand it's a sharing moment where we have got experts in the field. So the next 4 days starting today, you will be hearing from people who have been through this path. You will be hearing from the experts who will be discussing things with you, and those tips that will help you engage yourself more effectively, positively, and to make sure that you can make the difference that you have been making in every kid's life. So I wish you all success forward. I welcome you to Abu Dhabi University's virtual forum, where we are trying to have a 4-day session with various topics in the field of school counselors' readiness to change. And I hope that this session goes very successfully and we collectively will try to bring best to the region and to our students. Thank you so much.
Thank you, Dr. Sriti, for the great and informative information that you shared with us. And also allow me to thank Dr. Smitha and Ms. Rima and Ms. Nafis Sultana and Dr. Ranim and the team for their volunteer work and for participating and sharing their experience in the area of school counseling, which I'm sure will reflect positively on our participants and their work. Before starting our program and for successful completion of the certificate, kindly be informed that the following guidelines and ensure that you comply with them. To get the completion certificate or certificate of attendance, you need to register at Abu Dhabi University Community Portal. During the session, I will share with you the process of registering in the portal. Certificate of completion, participant who submit the final reflection will receive a completion certificate. If you don't want to receive a certificate of completion, you can get a certificate of attendance by just attending without submitting the reflection. The submission deadline for the assignment will be 8th July 2021, 11:59 p.m. Translation services will be available through our team. Mr. Omar is with us, so he will be providing you with the link and code for the translation. Comment during the session, you can write your comments in the chat box, in which we will be flowing and answering those comments. Question and answer or raising hands option, you can also use the Q&A option in the both later in the AHA slides that we will use, or some of our speaker will use, or during Zoom by asking any question, or you can also raise your hand in case there is the speaker want participation or want to engage the attendees with their sessions. During the school counselor readiness for change professional development certificate, 4 modules will be covered. The first one, advanced counseling skills, role of positive psychology and spirituality in the schools. The second one, ethical considerations in the counseling process. The third one will be behavioral and academic challenges among students, varying dimensions of and management. And the last one will be counseling young minds towards a future career with Ms. Rima Menon. Module 1, Advanced Counseling Skill, Role of Positive Psychology and Spirituality in the Schools, will be run by Dr. Smitha Dev. Dr. Smitha has been teaching psychology for more than 18 years in the GCC. She has a PhD in psychology, Master in Applied Psychology, and is working a faculty with Abu Dhabi University. UAE for the last 11 years. She also holds the responsibility as a chair of human departments for the College of Arts and Science. Dr. Smisa is also a psychologist and has the expertise in counseling and psychometric testing. Prior to joining Abu Dhabi University, she worked in Dubai, Muscat, and India, teaching psychology and worked as a psychologist with a hospital in Muscat and India. She is a recipient of the Best Faculty Research Awards from Abu Dhabi University for the period of 2014-15, 2017-18 academic year. She has her competencies and expertise in areas such as teaching, research, developing intervention program for learning disabled students, psychometric testing, diagnostic and treatment of learning disabled children, and counseling. She is the author and co-author on numerous peer-reviewed journal articles. Dr. Smith, and the mic is yours.
Thank you, Dr. Fatiha, and thank you, Dr. Shridi. Thank you for the introduction as well. Good evening, everyone. Thank you for your presence, all participants. Today, in this session, we'll be talking about the advanced counseling skills. Before that, we'll be discussing the basic counseling skills. I will also explain the importance of reading various approaches in psychology and counseling. Then we will solve a couple of cases together. So I hope this session will expand your toolbox a bit further. Dr. Fatiha, I wanted to share my screen. I'll be sharing the screen.
Yep, sure.
Yeah, I hope you can see my screen. Is it visible?
Yes, dear, it's visible. Good.
Okay, so as I told you before, let me start with the very basic things in counseling. I don't know much about the participants, so even if we have someone who doesn't have psychological or counseling knowledge, this session will benefit you. As I told you, this will add a few value to your knowledge. Main objective is we will discuss about the advanced skills in counseling. First, let us start with the definition of counseling. You know, the importance of reading the updated definition is, as you know, that this will keep all professionals in the same page. Not only that, this will help us to understand the potential direction from where we need to proceed. Okay, so according to American Psychological Association, counseling is the application of mental health, psychological, and developmental principles to change human behavior, thoughts, emotions. We can use this principle as an intervention strategies to change behaviors, thoughts, and emotions. And this will enhance the well-being of people. This will help people for their personal growth, career development, and even treating mental illness. So having a good understanding about the latest definition of counseling will help us to understand where we are standing now. Now, everyone is familiar with the stages of counseling. However, for the budding counselors, maybe this abbreviation gather will be very helpful. So first, G is mentioning greet client in a very friendly, helpful manner. See, I don't think I have to explain this further, but during the first stage of counseling, our intention is to develop that or build rapport or make the client very comfortable. You need to build that mutual respect. And emotionally, both the client will be very comfortable. In addition to that, I would like to add two more points here. Is one is nowadays the kids are very smart. So before they come to the counselor, they would like to, they might go to your social media and search for your background. So always it is beneficial if you restrict yourself from disclosing your personal information in social media, or in case if you are uploading all your information, you have to give yourself a nickname, or you can use initials. Okay, this can build the trust. Otherwise, during the counseling process, if you are giving a suggestion and your personal, these things are going, if there is any contradiction between what you are doing and what you are advising, maybe that can listen the trust between the counselor and the counselee. This is one point. Another point is, as or maybe you're all aware of it, we always have to keep our emotions very, like for example, as counselors, we are expected to have a very empathetic, warm, and very, what do you call, um, yeah, approachable attitude. We need to maintain that. Whereas, suppose if your client is saying something and it's such a shocking thing, and suddenly if you are showing that expression in your face, maybe again they will lose their trust. So these two things, if we can consider, probably building a rapport would be a little more helpful. All right. Then come to the next one, ask client about, see, when during the second stage, our intention is to have a clear picture about, you wanted to get a big picture about the problem. So usually some counselors I heard from students, like they find it difficult, or they feel like, oh, did I miss something? So if you have such suspicious things, if you are not very confident about the history you have taken, then what you need to do, you have to write down the goals and see. And if your goals are very specific, very clear, that means you got a clear picture about your client. All right. So coming to the third one is, you can tell client about different options. That is the third stage. What are the options available? Then you need to help client to make a decision. What would be your preference? What is the choice? All right. Then coming to the explanation stage, you need to clearly explain how they have to implement such solutions. And the last one, our return is important. Return or follow-up sessions are very important. I wanted to tell you before, when I was asked to do this session, I just went for a focus group study. Okay, and few students from school, grade 11 and 12 students participated, and they told me they are comfortable with the counseling offered by the counselors in their school, but they have a concern. Like, some of them told me the follow-up sessions are not very effective. And that is the most important part. So let me tell you why these follow-up sessions are very important. See, if you look at the stages of change model, this is an issue for me. Stages of change model, you know, stages of change model, I hope, I don't know, yes. So here, the importance of this is, this theory says that this is the time, like these are the 5 different stages we will take to get rid of an undesirable behavior and we cultivate a desirable behavior. Okay, so it will take 5 stages. The first stage is considered as pre-contemplation, where the client is not aware of the problem. And second stage is contemplation stage. Here suddenly he or she came to know about the problem, but still they are not ready to make any changes. In the preparation stage, they are planning for changes. Okay, maybe they go to the counselor, they seek help everywhere. Then fourth stage is action. till here. So the counselor is helping them, providing them more solutions, their own actions. Till here, everything goes smoothly. This is my understanding. And when you come to the maintenance, see, after until action, it's very easy. But after this, either the client can relax or they can maintain with the changes. So as counselors, we have to give more importance to maintenance stage. We need to apply the 2190 rules here. 21 days, you'll be having regular counseling sessions, and up to 90 days, at least once in a month, you have to do proper follow up until you develop a feeling like the transcendence happened. All right. So that is the importance of maintenance stage. Now, we will also, I want to discuss about the approaches in counseling. You know why it is important to learn the approaches in counseling is the first one reason is you will get a clear understanding about what are the causes of human behavior. Okay, these approaches are explaining. If you have a good understanding about the psychological or counseling approaches, you will get to know what are the causes of some of our behavior. Apart from that, these approaches will help you to plan proper intervention strategies. Okay, so these are the two reasons we need to enhance our knowledge in approaches. So, for example, I'll give you some examples. One is psychodynamic. You know, psychodynamic is one of the very popular Sigmund Freud's theory. And according to psychodynamic experiences, you know, this theory is focusing more into past childhood experiences, like pleasant and unpleasant experiences during childhood, how these experiences are affecting our personality later on or affecting our current problems now. Understood. So that is one reason. Say if the child is having a very unpleasant experience, like he was bullied during school years or had sexual abuses or the very authoritarian parenting style they followed at home, all this can affect the child's personality later on. Then another thing is, through the psychodynamic approach, we can also understand whether, you know, you will look at that part, whether this child is having some internal conflict. Maybe the parents are very strict, they are not letting the child to do anything. So all this internal frustration can reflect in their behavior, and that would be the cause of their misbehavior in the classroom. So similarly, you will be able to connect and you can understand the causes, through this we can understand why a person is behaving like that. The second one is cognitive behavioral approach. You know, see here, we'll be focusing about how our thoughts are affecting our behavior. Okay, so example, rational emotive therapy. Here, we are we are more into that faulty thinking. The counselor try to analyze the faulty thinking that relate to distress. So once you identify the negative thoughts, you know, people have a tendency to be very negative. Like some people, even if you're giving solution, from the solution they find fault. So such people, they badly need counseling, and the counselor should help them to restructure their thoughts. So this is another example. And another very, recently this is getting a lot of attention from everywhere, that is humanistic approach. And humanistic approach is focusing more into positive behaviors. Like this approach is emphasizing the importance, and they say you are responsible for your life. If you decide to be happy today, you will be happy. If you want to if you want to have a lot of stress, yeah, you will be stressed out throughout the day. So that is what it's all about, positivity. And from humanistic approach, we will talk about positive psychology. So this is one of the very latest or recent domain of psychology. And I want to tell you a little bit history of positive psychology. So during the origin of psychology, there were three missions in psychology. One was, first mission was curing mental illness, and second one was making the life of people more fulfilling, and third one is identifying and nurturing high talents. So what happened, that time, that is in 90s and all, after the World War, there were a lot of people suffer with mental disorders. So most of the professionals' attention went to mental illness. They were focusing more into treating mental illness and finding new therapies and all. So there was a big stride, this area developed a lot, whereas the other two areas got neglected. So until 21st century, these other two missions did not get any attention. Very recently, in 21st century, during that is a time where they develop positive psychology, and positive psychology is focusing more into prevention of mental illness and the other two functions, like they help people to fulfill their life, to make their life more meaningful, and they help people to identify their talents and nurture their talents. So that is the main purpose of positive psychology. I wanted to tell you how you can use or implement these principles in your school. So, that schools have a very important role in building individual strength and improving well-being in adolescents. So let us see how we can adapt a perma-theoretical model in the schools. As might be, many of you heard about this perma-theoretical model. This was proposed by Seligman. Seligman was also one of the founder father of positive psychology, and according to him, he identified five main elements that is very critical for long-term well-being of a person. The first element is positive emotions, engagement, positive relationship, meaning, and accomplishment. So let me tell you what you can do in your school. See, suppose if you wanted to, I know that you might be doing a lot of co-curricular activities in the school, but if you're doing it, if you can align with this model, and if you're doing it in a more structured way, the outcome will be really good. So the first thing is positive, how you can encourage positive emotion. I'm just giving some example, like, as part of the moral education, you can encourage students to practice journaling blessings, like, gratitude journals, or part of your morning prayer or assembly. You can make them practice mindfulness, loving kindness, meditation, these kind of things. Then when you come to the second element, which is engagement, most of the schools are conducting a lot of co-curricular activities. But, if you look at yourself, you'll be always picking the smart ones and you ignore the others. Maybe 10% of the students will get a chance to participate in debate competition or that and this and all. But what I feel from this model, what we need to do, every child should get a chance at least once in a year, like to participate in discussion, debate, playing musical instrument, reading book, any kind of activities. This engagement and once they realize that they'll be able to express their talents, that will give them a sense of confidence, and also this will boost their self-esteem. All right, and the third one is relationship. Relationship always give purpose in life. So connecting with old friends, or having a family day with cooking competitions, all these kind of community services will help them to understand the meaning of relationship. And the fourth element is meaning. How we need to see our life more meaningful. Always we'll be searching for that, what is the meaning of my life? So here, you can guide them properly from the beginning. So what we need to do, so for an example, engaging volunteering in social activities. And every time, wherever the people need a helping hand, let them extend their hand, help them, or voluntary services. All this will give more meaning to their life. And the last one is accomplishment. All of us, the end of the day, we need to see our accomplishment, and that is something which is motivating us. So it's not only success in academics. Very few students are really excelling in academics, but every student, if I'm not good in English, maybe I'll be good in math. So we as counselors, our role is to help them, encourage them to find out their talents or their aptitude, and let them participate in sports, games, or any other events where they should also get an accomplishment. They should feel that, yes, I'm successful in life. And these are things which motivate them in their life. Okay, so this is PERMA model. And when I was reading the research reviews, I have observed that many papers are already there related with the PERMA model. And these researchers are saying there is a significant positive association between PERMA component, physical health, then job satisfaction, etc. So it's always, I have a request that if we can follow this in school, if we can adapt and change it in your own way, that will be a great benefit for our children. Coming to the next one, which is spirituality and wellness, how we can incorporate spirituality with in school environment. So there are a lot of studies which is linked with how religious practice is directly linked to life satisfaction, or how spirituality is positively correlated with gratitude, forgiveness, and empathy in older adult. So my understanding is always, spirituality can shape our actions, and it is directly related with our values and our ethical behavior. Okay, what as a counselor, what you can do in your school is you need to encourage your student to participate in faith inspired cultural events. Maybe you heard about um, in Dubai they have Quran competition, Bible competition. These kind of cultural events, you need to inspire your students to participate in such events, would be more beneficial to cultivate spirituality. And as I told you, the spirituality will always help the children to be more disciplined in their life. Yes, let's take a small break. Along with the break, I want you to solve this case for me. Okay, this is the QR code. Can you please scan it? Everyone, please scan it. Once you're done with this, please let me know. Okay, I'm going to hide it. I want you to read this case and you have to answer. If you are not able to see the entire case in your screen, I'm not seeing any answers.
Dr. Smita, maybe you need to give them a time to read the case.
Yes, they can see it in their phone, doctor.
It will be the, okay, fine.
Okay, so let me go to the, yes, answers are coming. Thank you. Good. So I'll go to next slide. One more answer you have to give from the same case. If the questions are there in your phone, you can even go back and see that. Good. Good. So I have seen a lot of answers. I'm so happy to see your answers. He said majority of the answers said identify the problem. So it's bullying, verbal and mental abuse, verbal abuse, bullying, lack of concentration, ignorance on part of the teacher. Very good. So moving to the next responses. You said it's cognitive therapy. Very good. Student counseling. I was asking the therapy, implementation of strict laws and policies. Very good. Encouraging student to respect others' orientation and dignity. Good. Individual counseling and motivation. Right. System approach, cognitive behavior therapy. Individual counseling. Remedial plan, consultation, follow up with parents. Very good. PERMA model we just learned. How? Cognitive behavior approach. Yeah, that's good. Rational emotive therapy. Good, Rohini. So here is the answer for you. Go back again. Approaches like behavior treatments include, as he said, the student was having severe anxiety when he was asked to go to school. So that was the main issue. Then behavior treatments include systematic desensitization, okay, graded exposure to the school environment, then relaxing training, emotive, imaginary, contingency like reinforcement, Social skill training, cognitive behavior therapy is a highly structured approach that includes specific instructions for children to help gradually increase their exposure to the school environment. Then, as some of you suggested about parent-teacher intervention, yes. So maybe the parent can accompany the student in the school, escorting the child to school, providing positive reinforcement for school attendance, like, and decreasing positive reinforcement for staying at home. If the child is staying at home, you cannot watch TV. And you should give them a tough time so that they will try to escape to school. All right. So these are the various strategies you also suggested, and this is the correct strategies which we can implement. Now let me move to the next section, which is the basic counseling skills. I'm not explaining much here. However, you know that. So the first skill is like attention is very important. I know that when you grow old, maybe you find it difficult to sustain your attention. But in counseling, if you are in the counseling profession, both verbal and non-verbal, attending and understanding the verbal and non-verbal languages are very important. Then reflecting and paraphrasing, you summarize what the client, summarize the client story. Then summarizing the main points, question, open-ended and close-ended question. Then focusing on the main major concerns. Then having a proper rapport. Then finally, silence always facilitate counseling. Okay, these are the basic, very basic skills which we use in our regular counseling sessions. And coming to the advanced skills. In advanced skills, confrontation or challenging skills. So sometimes some people, they don't walk the talks. Maybe during counseling sessions, they speak something and they practice something else. So if the counselor is observing such discrepancy or disagreement, if you're repeatedly observing this, then you need to say that your thoughts and actions are different. Okay, this will increase their self-awareness. People who, if your teenager is doing such things, they are not walking with the talk. What we can do, we should point these things, and that will help them to improve their self-awareness. All right, so I can give you some example. See, you say you would like to do further study, but you haven't contacted the training session. All right, so that they'll be getting some idea. Yeah, I was talking about this, but I couldn't do it. Your words say that you would like to spend more time with your sister, but your action says that it's not a priority for you. So similarly, many things, so see, as human beings, if somebody else is pointing our fault, then only we'll be able to recognize things, okay, most of the time. Otherwise, people are very sensitive with such criticism. So what you need to do, you have to use your words properly, and you have to put that statement in a very positive way. All right, that is confrontation. And the next one is self-disclosure. As you know, therapist self-disclosure means, the therapist is sharing some personal issues with the client. So suppose the advantage of sharing your personal issues, it's a very sensitive thing, but however, the advantage is the client feel very comfortable. This can increase the bond between the counselor and the counselee. Okay, so it's easy to build that rapport, and you can establish a proper relationship between you. Number one, see, I'm giving you some examples, like if you want to share the feelings. Yeah, I get angry when someone pushes in front of me like that. Or you can also say, when I was in university, I was also, I was suffered with anxiety disorders. Okay, so they feel like I'm not alone. Another person was having the same issue, and now he is very successful and sitting in front of me as a professional. So this kind of feeling will give them a sort of confidence, and we can also improve our relationship between the counselor and the client. And next one is immediacy. Immediacy is also, you need to use this whenever it is appropriate. Here, see, whenever you encounter difficulties in counseling, suppose suddenly you notice that your client is no more interested. Maybe he's coming to the session because of the parents. Parents are forcing them, so he's come and he's not paying any attention and sitting there. In such cases, what you need to do, you need to invite the client to look at what is going on between them. Okay, so you can use statement like, see, you're not maintaining any eye contact, or you're not looking at my face. It seems like you are not interested. These kind of statements will help them, to motivate, or you can gain their attention from them. So when to use immediacy? If there is an issue of difference that might be affecting the relationship. Like, I'm aware that you have, is an example. I'm aware that you have said that you never get angry, yet I'm sensing that you're very angry with me. That kind of situations. Or whenever you deal with difficulties, as I mentioned before, for example, you can say, you told me first when you arrived, you never trusted anyone in your life, and now I also have that fear that you are not able to trust me. So these kind of statements will help them to understand the importance, and maybe you will be able to gain their confidence. Then guidelines, some guidelines for using immediacy is, always you have to be very clear and direct. And as I told you before, choose your words very carefully. Also think twice before you use immediacy in your counseling. Maybe it can spoil the relationship. Oh, what do you want? If they ask like that, probably you find it difficult to go further. Then another skill is advanced. Another skill is values. Values are very important. So in your counseling, we need to incorporate cultural diverse values, religious practice in your counseling process. Do you know why it is important? Actually, I heard this story from Rama ma'am. Like, one of her friend, she sent her son to a counselor, and she wanted to change. The son was having an affair with a girl, and the mom was against it. She wanted to change that relationship. But lately, what happened? The counselor started counseling the mom, saying, see, this is normal part of the child's development. The counselor was of a Western origin. So it should not come back to you. Always we need to consider, especially we are in a multicultural environment, where we need to be very sensitive with their religious, cultural values, all those things. And coming to the next one is core conditions. I wanted to tell you, because everybody is aware of this, what are the basic traits we need to cultivate as a counselor is, um, we should have that empathy, that to cognitive empathy. Cognitive empathy means an accurate understanding or knowledge about your client's problems, or if you have the ability to feel like, how they are feeling, that is cognitive empathy. Then genuineness in your attitude, in your behavior. You always show that genuineness, which can enhance the trust between the counselor and the counselor. And you need to have that warmth in your relationship. So these are the few core conditions. And I don't know whether you heard about capping. Capping, we can use whenever the client go very emotional. Like, sometimes, especially when you counsel a patient with a depression or anxiety disorders, they try to take all the blames on them. They feel like, oh, everything is happening because of me, this kind of attitude. So in such condition, you need to help the client to convert their emotional statement to cognitive statement. So maybe you need to probe them. You can ask more logical questions and help them to understand it is not your fault. If there is a problem, means many things are responsible, many factors are responsible. So a probing and proper interference will help them to be away from that emotional state. And especially if you feel like you need to pacify that specific condition, you can apply this capping technique. Then Next one is hierarchy of needs. You might think why we need this here, but this is something very important. I'm sure that all of you are aware of this Maslow hierarchy of needs. So according to Maslow theory, we need to satisfy our needs in a specific order. First, we need to meet all the basic needs in order to meet the high order needs. Okay, this is very much applicable in counseling as well. I wanted to share another case with me. This girl, 13-year-old girl, she came to clinic. She came with her teacher and father. And I remember my teacher was telling me she was a topper in the class, and suddenly her grade started dropping. Okay, so they try to understand the reason, but the girl was so reluctant to talk to them. And after one or two sessions, I heard that her mother was having a illicit relationship with her father's friend. Okay, and when she questioned her, her mother shifted her infidelity to this girl. Okay, and she threatened her, saying, "I will inform your dad, and I will say that he is your boyfriend." Okay, and so the girl was so confused, so upset, and so disturbed. So what we need to understand, if the child is not having safety at home, and since that what she told me, her mother's attitude was completely changed. So if you feel so insecure at home, how you can think about studying hard and getting good grades? So these kind of things also we need to consider. That's how we can incorporate. And similarly in Gulf, in UAE and all, another problem is now people are losing job every day. So that is also causing a lot of insecurity among people. These things also we need to consider while during the counseling process. Then another one is solution focused brief therapy. Um, this is a very recent therapy, and it's very effective during this online period. So if you're an expert in telephone counseling, online counseling, you can use SFBT. Here the therapist is focusing more into um, solutions rather than focusing on problems. Okay, so you don't go for psychoanalysis or behavior therapy or cognitive therapy. Here your focus is into solution. How I can help this person. And this is a very quick process. It won't take much time. You can also manage your time properly. One of the step is like the miracle questions. I found this very interesting. The counselor asked some miracle questions like, what would be different in your life if you get rid of this habit? This kind of questions really get into their mind and they think about changes. So that is SFBT, solution focused brief therapy. Then evidence based practice. For me, as we are all professionals in counseling, my personal suggestion is, please read articles from scientific journals, which is scientifically or empirically proved. Okay. And also you need to see whether it is replicated by more than one researcher. These articles will give you new techniques. You know that one technique will not work with everyone. So reading, cultivating that habit, reading a research article will help you to experiment new techniques in counseling. See, I have given a link for you, online library at willy.com. All American Counseling Association's journals are available. A list of journals are available. You can choose and you can start improving your skills. Now we are here in the assistive technology. I don't know what are the various technologies you are using in your counseling sessions. Here I have mentioned a few. I hope this will be useful for you. First, I will start with virtual reality. The term will be familiar, and how we are using this in counseling is, suppose you decided to use systematic desensitization and you want to treat a patient with phobia. So usually what you do, you slowly expose the client to the situations. So instead of exposing the client to the real situations, you can immerse them in a virtual environment. Okay, so that is how we use virtual reality in counseling. If it is affordable, definitely we can use it. I have a video for you. Please listen. Hope this will be helpful.
Virtual reality program.
All right. So if your school can afford, maybe we can try this. The next one is therapy application. So a lot of apps are available um, for like, for example, if you wanted to record your personal information, like if you wanted to record, if you wanted to monitor the symptoms, or if you wanted to do a self-assessment or a or if you want to educate yourself, or in psychotherapy, skill training, all this we can use different types of therapy applications. And I'm going to try one application. I'm going to play a video for you, and what you have to do, don't close your eyes, open your eyes, focus this video, and you have to follow the instructions. All right? Let us relax together now.
Dr. Smith, is there an issue with the voice? Because
Yeah, doctor, let me do that again then. Let me share my screen again, okay? Just let me play it again. Yeah, once again, please listen. Thank you.
So sitting comfortably, just beginning with a nice big deep breath, breathing in through the nose and out through the mouth. So eyes open, a soft focus, As you breathe out, you can allow the breath to return to its natural rhythm. But just keep the eyes open for a moment. Just focusing in on one particular object within your field of vision. Not staring at it too intently, still aware of the space around you. But just gently focusing on that one object. And then just slowly zooming back out again as you blink a few times with the eyes.
I don't know whether you got that relaxed feeling. I hope. And let me play this video again. I heard that there were no voice. Let me play this again. Please listen. This is for virtual realities.
The program is pretty new at CAPS. It is a virtual reality program, and we're using this technology with students to help them with their fears. A lot of those fears could be related to fear of flying, fear of public speaking, fear of spiders, different scenarios in which evoke a lot of anxiety for individuals. Clinicians have been using this to integrate exposure therapy for a lot of veterans with PTSD. I think it's really exciting that we now have the resources to be able to use it within our counseling center, and so students have access to it as well. I really love doing exposure work with clients and being able to have them move through their fears. And sometimes when you are doing exposure, you don't have access to the things in the real world. And so the VR program really allows you to do that.
Okay, I hope you have some idea about how we can use virtual reality. Virtual reality, as I told you, an example. Instead of exposing the client to the real situation, we can expose them to the virtual world. And the therapy application we can use for monitoring symptoms, self-assessment, psychotherapy, psychoeducation, etc. Now moving to the next wearable sensors. I don't think I need to explain this. Everyone is familiar with wearable sensors like rings, wristbands, and watches. Actually, we can record our personal information, like, also people who suffer with bipolar or depression, they can monitor that mood fluctuations. So in such cases, these wearable sensors are helpful. Then the last one is serious games. This was one of the most interesting technology which we can use in counseling. Yeah. So the serious games are not for entertainment. We are using serious games to facilitate learning, training, or even therapies. And there are many serious games available to treat depression, dating violence, anxiety, psychosis, and impulse control disorders. See, I can give an example for serious game, which you can also find this in Google Play Store, Word with a Friend. So this is very effective. Even research articles are there, which is proving the effect of serious, what is that? Word with Friend. So Word with Friend you can use for depression. And another one is Love in the Dumpster. Okay, a serious game about teen dating violence. This is also having a lot of researchers are proving the efficacy of this serious game, where this is something which we are using to prevent dating violence. Actually, this app is very useful, and that will help students to identify abusive relationship. So even if you have teenage daughters or even son, You can introduce this to them. That will help them to identify such abusive relationship. And also it's so confronting and preventing teen dating violences. All right, so let me show you an example.
Obsessive compulsive disorder, OCD, is a chronic, debilitating disorder characterized by uncontrollable, obsessive thoughts and compulsions. Treating includes cognitive behavioral therapy, CBT, as well as medications. Exposure and response prevention, ERP, is a form of CBT in which the patient is exposed to the stimuli and guided through the response until the patient learns to tolerate the stimuli. Online interventions for psychological status include mood, anxiety, and behaviors are increasing owing to their accessibility, ubiquity, and cost-effectiveness. Serious video games are a good example of such effective interventions. To study the effects of a serious mobile-based game designed to aid OCD patients using ERP, a group of scientists from Chung'ung University Hospital and Stanford University School of Medicine conducted an experiment with 15 OCD patients and 15 control subjects. All subjects completed baseline questionnaires and a resting state functional MRI, and the OCD patients were asked to play the game for 30 minutes per day, 5 days per week, for 3 weeks. The game involves some specific OCD-targeted tasks. By asking the player to make a short pause before completing a final task, the game helps OCD patients increase their awareness of OCD-related anxieties by disrupting the thought-action fusion. After 3 weeks of gameplay, the patients showed improved symptoms and increased functional connectivity in brain areas involved in cognitive control, error processing, and procedural learning, the dysfunction of which usually results in OCD. These results show that by altering functional connectivity in patients, serious gameplay may improve symptoms of OCD.
Yeah, so serious games also facilitate counseling process, and counselors can use this another tool to expand their counseling skills. And next, I have one more case study for you. First, I want you to read it. I don't know whether it is completely available in your phone. So please go through it. Then I'll move to the next slide and you can start answering it. Can I move the slide? I hope the question is appearing in your phone or your sound issues. Let me go back to the story. I'm not seeing any answers. Thank you. Stress management section. How come? Dysfunctional family, lack of, very good, lack of support, lack of empathy, lack of guidance. Oh, I don't know who muted me. I was talking here. So yeah, issues like dysfunctional family, very good. Lack of support, good. Lack of empathy, lack of guidance, disturbed mindset, mood swings, eating disorder, unidentified school stress. Anxiety, depression, lack of social relationships, lack of interest, anxiety disorder. Okay. Right, depression, good. So moving to next question. Should I go back to the story again? Social interaction, encouragement, cognitive therapy, CBT, yes, mindfulness, systematic desensitization, supporting network, very good. Establish a strong counselor-client relationship, seek more information about why Rani is avoiding school, find out what motivates Rani to return to school, what she's doing at home, identify social support, enhance social and communication skills. Very good. So let me go to my answers. Issues identified. I have seen these answers. High level of stress and anxiety. Rania started sleeping continuously and withdrawn from others to deadening her feelings, just want to forget everything and sleep. Large amount of unstructured time. She's not able to cope with her negative thoughts and she was feeling very sad. She was not regular to school. And then lack of personal support network. Even since the parents were separated, she had no siblings, no friends. So that was another problem. And let us see the solutions. I have seen this answer. Schedule enjoyable activities like, she can try jogging, calligraphy, painting, reading, walking on the beach, whatever she loved to do. Yes, I have seen this also, cognitive restructure. So CBT might be very efficient. A short-term intervention, CBT program. And when I was doing my internship or practicing, it was very difficult to come with that CBT worksheets and all. But nowadays, everything is available. Plenty of worksheets are available in net. So planning such CBT programs are not very difficult. Then rational emotive techniques. No, all these are very effective. Then the last one is ongoing support. Support is always very effective way of treating such problems. So counselor referred Rania to her local community health clinic for ongoing monitoring and follow-ups. Follow-ups are very important, as I told you before. Until they reach that point that transcendence happen, we need to ensure the follow-up sessions. All right, so I have done with my part. Thank you so much. Thank you for listening to me.
Thank you, Dr. Smita, for this informative session.
Thank you, Doctor.
I think now we have to answer some questions, if you don't mind. So there are some questions here in the area of questions. We have a question from Basma. What are the best way to follow when we face resistance to talk, especially from teenagers? Some cases stay silent, refusing to interact, whatever method you follow. Dr. Smith.
Can you repeat the question? Let me see whether I can see the questions. What are the best way to follow when we face resistance to talk, especially from teenagers? Some cases stay silent, refusing to interact whenever. Yes, yeah, of course, it's difficult to deal with teenagers. So that, rapport is very important. You have to go down to their level. You have to establish very good, that trust and friendship. Maybe it takes some time. We have to patiently wait until, and suppose if that particular child is interested in some video game or some books or some kind of movies, you need to understand that what is their interest, and from there you need to work with that. So slowly it will take time, but definitely they will come to your they will come to your level.
Yes, I agree with you. Actually, it takes time. And again, as you mentioned, and it depends on the way counselor.
Always we need to understand their interest, and we need to move down to their interest. That is the best way.
Yes, right. Of course.
So they feel comfortable, yes.
If you allow me, also counselor can create such activities to engage these students together in order to reduce this behavior, like being hesitate or feeling resistance or whatever. By engaging them in some activities, they automatically build and develop the relation with the counselor. I think there are a lot of activities, as you know. Okay, I think there is another question here, or not a question, maybe.
Parents need counseling. Okay,
yes,
fine.
Yes,
True.
I think
Parental counseling
right,
is also, yes, we are also end of the day human beings. Then does Abu Dhabi University has student counseling? Yes, we have student counselor.
We have center in Abu Dhabi University, and we have counselors, and we have a lot of cases. Yes, like any other school, of course. Any other questions? If our participants like to ask or to give any comments, we have 2-3 minutes. You can raise hand if possible. Okay.
Or if participants would like to share something, you can go ahead and do.
Yes, anyway, you can also send your questions, and later Dr. Smith and the team can back and answer and give any feedback in the discussion. Okay, if there is any questions or comments, thank you. Would like to give our full thanking to Dr. Smith for this informative session, and thank you guys also for your attendance and being with us, and see you tomorrow, inshallah, when in our second round tomorrow at the same time. Thank you, and welcome. Best wishes, and see you tomorrow. Good luck. Thank you so much.
Thank you, everyone. Have a great evening.
Thank you.